A tension pneumothorax is a medical emergency. It needs to be decompressed very quickly or the patient will die. We need to look for the second intercostal space halfway along the collarbone, which is from here to here. That's roughly halfway. Immediately below the collarbone is the first rib space. You will then feel the second rib, and you want to go into the space below the second rib. Your equipment: a syringe with some water and an ordinary Venflon. The bigger the better. Remove both tops from the top of the Venflon. Attach your syringe and then just remove the needle sheath. Re-identify your area and then put the needle right up to the hilt into the chest, going at right angles to the patient. Once entered, you will find that you can see air clearly entering the syringe, and you have relieved the tension pneumothorax. We're now going to look at the insertion of a chest drain. Remember, it's never an emergency. You would only ever have to insert a chest drain on the advice of your medical advisor. There's a triangle of safety within which the chest drain has to be inserted. The triangle is marked at the bottom by a line across the nipple, by a line down the middle of the armpit or axilla, and by a line from the muscle here which runs down, giving us triangle. Traditionally, we put it within this triangle in the fifth intercostal space in the mid-axillary line. So, counting the ribs down, this is going to be where we insert our chest drain. Insertion of a chest drain is painful. Your medical advisor will probably suggest that you give some sort of intramuscular analgesia, and that would be given half an hour or so before the procedure to give it time to take effect. The first step is going to be then introducing local anesthetic. In the pack you will see there are 3 sizes of needles. The first one is for the superficial skin area. Draw up 10 mils of local anesthetic and attach the smallest of the needles. Remember to put this in very shallow. Draw back to make sure that you're not in a vein, and then just inject gradually, small amount, round in a complete circle. Remove the needle and then attach the next size. This, go in deeper into the subcutaneous tissue, again drawing back to make sure you're not in a vein, and gradually injecting. And then with the final needle, you're going to go in right to the level of the rib, and you will feel the needle hit the rib. And just inject as you pull out from there. Remember, this is a sterile procedure. Our next step is to swab down the area that we're going to be working on. And repeat this 2 or 3 times. And then having draped the area, our next step is to take the scalpel and make an incision. Oh, perhaps an inch or so. We now need to extend this incision through the muscle down to the rib. 2 ways of doing it. One is to use forceps, pop them into the area and just open and close them several times, and that actually allows you to force open the muscle fibres. An alternative to the forceps is to use your finger to develop a gap in the muscle fibres. Then prepare your chest drain. The chest drain comes with an introducer. Remove this. We're not going to use it. Remove the cap at the top, and using your forceps, insert them into one of the holes at the top of the chest drain. Pop your finger back into the space that you've created and use that as a guide to insert the chest drain. You can, if you want, clamp off the bottom of this whilst you insert the chest drain. It's useful if there's fluid, but less important if it's purely air. Once we have this in place, we can remove the forceps. The next step is to attach the chest drain to the wall and attach a bag to the end of the drain. We'll look at attaching the chest drain to the wall shortly, but firstly, if we have a look at how to attach a bag. This piece of equipment which you have in the pack clearly shows which side attaches to the lung side and which attaches to the bag side. So insert this side into the lung side and the bag to the other side. The Abermed chest seal is essentially designed for treatment of a sucking chest wound. It has a one-way valve that allows air to escape. What to do is to take the end of the chest drain and just with a bit of pressure push through. Then remove the backing and attach it to the chest wall, giving you a very, very good strong seal. And then, of course, just attach the bag as normal.